Coming up on Aging Matters, Fall Prevention.
So I noticed that as I got older, that I was less stable, and I did not want to fall and hurt myself.
I'm afraid of falling because my knee gives away with me.
Every year, about 3 million older adults end up in the emergency department because of a fall. And about 800,000 of those are hospitalized because of the falls.
Next thing I know is I was sliding on the wood floor. There was nothing to grab onto to keep me from falling.
The reason why falls are so traumatic in the elderly population is that they have an increased loss of balance, a decrease in their core stability.
There are things that we can do to keep our bodies strong, to reduce the risk of falling as we get older.
Falls truly are not a normal part of aging. We know what the risk factors are for falls, and when we educate older adults about what their risks are and provide them with strategies to reduce those risks, then we can prevent those falls from happening.
Major funding for Aging Matters is provided by the West End Home Foundation, enriching the lives of older adults through grant-making, advocacy, and community collaboration. The Jeanette Travis Foundation, dedicated to improving the health and well-being of the Middle Tennessee community. The HCA Healthcare Foundation, on behalf of TriStar Health. Cigna, together all the way. Additional funding provided by Jackson National Life Insurance Company, the Community Foundation of Middle Tennessee, and by members of NPT. Thank you.
Each year, millions of people over age 65 fall. In fact, falls are the most common cause of fatal and non-fatal injuries among older Americans. Those numbers should give us pause, but they shouldn't paralyze us with fear. Hi, I'm Kathy Mattea, and on this edition of Aging Matters, we'll explore the risks associated with falling and what we can do about them. Falling is not inevitable, but there is a lot to think about. How can we improve our balance and strength? What can we do to increase our awareness and eliminate falling hazards in our homes? How can we best manage chronic conditions or side effects from medications affecting our stability? We'll answer these questions and more in this edition of Aging Matters. Stay tuned.
Most people know that I'm a very hyper person. I can't sit still for a minute. I go day and night running around. I liked gardening and working in my yard.
Sandi Lasher has always maintained an active lifestyle. The secret, she says, is doing things that she enjoys, and that includes getting her daily steps in.
And I could go for hours and not realize I put all this mileage on my feet walking around.
These days, however, it's been a bit slower going.
Well, I fell about 8 months ago. I went to visit my son. I walked outside at his courtyard to look at the snow and everything, and I came in the house, and he has wood floors, and I had these slippery socks on. Next thing I know is I must have had a clump of snow on, and I was sliding on the wood floor, and there was nothing to grab onto to break, keep me from falling.
Studies show that for older people, wearing slippers, going barefoot, and wearing socks without shoes may increase the risk for falls in the home. In Lasher's case, that fall resulted in a fractured hip, which required major surgery and ongoing rehabilitation. The injury has taken a toll, not just physically, but emotionally.
I've reached, 60-some years old, and I've had a very healthy life. Being the person that I am, I kept thinking, there's no way I'm laying here. There's no way I'm going to be bedridden here. So I've got to get back on my feet and get out there and do the things that I'm missing out on. It turned out it's taken a lot longer than I expected, to the point the last few months I got really depressed. I'm just afraid to jump in the water and do certain things like I used to.
Falls really can be a traumatic event for many older adults. Often it can cascade in bringing their health down, and so they may limit their activities, which in turn puts them at higher risk for falls. They may have muscle weakness, their balance may decline.
Life changes, and a natural part of aging is adapting to the changes that occur in bodies over time. The little things can add up. Shortly after retiring, Sandi's husband Steve developed severe sciatica. Not only was it painful, but it limited his activity and increased his risk of falling.
I realized that if I didn't find a solution to manage my sciatica, this was going to be a lifelong problem. I joined the yoga studio. I spent a year and a half training, and my sciatica completely cleared up and went away. So I realized that for me, yoga was solving health issues that I was facing as a senior.
Today, Steve is a certified yoga instructor. And while yoga has always been his activity of choice, Sandi has begun to see how it could improve her balance and flexibility as well.
Hands are out the side.
It's all about stretching, and it's all about keeping your body limber and movements, and if you keep all that, you're more active.
We firmly believe it's very important that starting at a very young age that people stay active. We have to, get off the couch. We have to move around. We have to develop a routine in our daily lives where we do engage in physical activity for lots of reasons. We know that physical activity is important for preventing chronic conditions and managing them once you get them. But in particular for falls, if someone sits on a couch for long periods of time and has a very sedentary lifestyle, that person is going to be at higher risk for falls because they're going to develop muscle weakness, their balance is going to be off, their gait may be off as well, which puts them at tremendous risk for falls.
While there are benefits to any form of physical activity, research suggests that some forms of exercise are especially good at preventing falls. Tai Chi, for instance, has been found to reduce the risk of falls by up to 55%.
So what Tai Chi does to help reduce the risk of falls, it strengthens the muscles, the tendons, and the subtle muscles of the body, the fascia muscles. These are the muscles in our body structure that kind of hold the frame together, keep us upright. So what Tai Chi does is it slowly strengthens those muscles through the gentle movements. And so they become available to us whenever we encounter an imbalancing situation in life.
Tai Chi was a really great first step for me because you don't have to have any special clothes, you don't have to have any special equipment, you don't have to move your body in funny ways that might cause a strain or an injury. It's just a really gentle way for me to get back into moving my body.
I've had members of my family fall, and I have also fallen myself. Safely, thank God. I never got seriously hurt when I fell, other than bruises. But as I got older, I became aware that there is more likelihood of falling.
For Brian Donohue, Tai Chi became a way to reassert control over his own body and improve not only his strength and balance, but also his confidence.
I became very aware of what a stable position is like, and I carry Tai Chi with me throughout the day. I'm always conscious of what I'm doing, how I'm walking, how my balance is.
By improving their balance and strengthening their core muscles, people like Brian and Harriet have taken a giant step toward protecting themselves from a fall. And according to experts, that could be a lifesaver.
So what we believe is that the majority of elderly falls are related to a frail condition, that is a harbinger of a shorter lifespan than somebody who's able to protect themselves. So what I mean by that is, if you fall, if you end up with an injury that puts you in the hospital and you're over the age of 65, that lends itself to what we believe could be the last year of your life in about 30% of those patients.
The key concept here is frailty. That's the gradual loss of strength and energy, which leads to weakness, tiredness, slowness, and loss of balance, according to researchers at Vanderbilt University School of Nursing. They have shown why it's so important to delay frailty and prevent falls among the frail.
We enrolled almost 200 adults age 65 and older who were admitted to Vanderbilt with an injury, and we measured where they were in terms of their frailty. Were they non-frail, were they pre-frail, or were they frail? And then we looked at their outcomes at 1 year after their injury.
For non-frail patients, more than 6 out of 10 had a full recovery. 3 out of 10 patients were worse than before the injury, and less than 1 patient died on average. Among frail patients, on the other hand, only 2 out of 10 returned to where they were before the injury. 4 out of 10 were worse off, and another 4 out of 10 died.
Needless to say, since my research has centered around frailty, the more that I've learned about it, it's forced me to look at myself and say, well, this is happening to my body too. What am I going to do about it? In my early 50s, I really began to give attention to the things I needed to do to mitigate frailty. And that includes, I think, number one is your physical activity.
According to Maxwell, our ability to generate energy gradually declines as we age. Tiny cell engines, or energy engines called mitochondria, weaken and die over time. But we can strengthen and generate new energy engines by creating a demand for them, and that includes physical activity.
We have to take care of the energy engines in the cells of our body. If we don't give attention to them, they're not going to function as well. The same as with a car engine. If you let a car just sit there for years and you never use it, you're not going to be able to start it and run it, right? If we have maintained our physical activity and other healthy factors, lifestyle factors, over time, as we age, and we've maintained our body's ability to generate energy, when we experience a fall, or any other type of external stress, or COVID's another good example. When that happens, our cells are going to have a better ability to combat that stressor.
While physical activity is at the top of the list when it comes to preventing falls, you should always consult your physician before beginning a new exercise routine. As the saying goes, safety first, and that philosophy applies to other areas of our life as well, namely our home environment.
The most challenging thing about caring for my mom is trying to guess when she might fall, to plan for it, and then to plan for how to get her up after she falls.
Along with her sister and husband, LaWanda Harley cares for her 92-year-old mother in the family home. In recent years, her mom's mobility has declined, and she did experience a painful fall. But it was a case of pneumonia that led to some professional assistance.
It was the occupational therapist and the physical therapist. She had 2 different people that were coming in that really helped me to manage some of the things she's going through. So they taught me how to manage her going up the steps when she was still on her own and could use her legs.
In addition to caregiving advice, the occupational therapist also implemented some fall prevention measures around the house.
So the first thing we did was to get rid of the rugs. The next thing we did was to make sure railing was put in. We already put in the stair lift to make sure that all she has to do is sit down and glide down the steps. There will be other stages. Right now we're trying to do everything we can to make sure Mom stays at home.
After being hospitalized, a doctor may write an order for occupational and/or physical therapy. But you don't have to wait for an incident to occur before seeking help. 50 Forward is a nonprofit social service organization for older adults in Middle Tennessee, and they offer something called care management.
As I was saying about falls and fall prevention, is we think about the fall moment, but what we need to think about is everything leading up to it and just be very intentional. So I always tell people you should not be afraid, you should just prepare. Care management functions sort of as a linchpin for other services. So if we are conducting a home assessment and we see that perhaps there's grab bars or something needed in the bath, then we often will connect with resources like occupational therapy. So we will work with an older adult to see if their physician will write an order for occupational therapy. Here, it would be great to have a grab bar as well. So that seems like a good... What we say to folks from the very beginning, both through our lifelong learning centers and through care management, is that it is never too early to begin thinking about how you can be safe. So walking with them to look at how the home is laid out, how the lighting is organized, whether there are things like throw rugs that maybe you're attached to and you have loved for a long time but now are presenting a hazard to you. Whether you have pets, pets are another issue that really has to be thought through as people age. Whether there might be some simple fixes around grab bars and things in bedrooms and bathrooms. So we look both talking with the older adult about what they want, what their goal is in the end, and then how the home is set up to meet that goal.
While many of 50 Forward's services and referrals are free or on a sliding scale, actual home repairs can be costly, and that could dissuade lower-income people from even seeking services. But organizations like Westminster Home Connection are helping bridge the divide between income and safety.
Westminster Home Connection is a nonprofit that focuses on doing critical home repair and mobility modifications to empower older adults and people with disabilities to age in place safely. Mobility modifications would be one of the top things we see, where people are falling, they're not able to have stability going in and out.
On this day, Westminster was installing a ramp, which will make it possible for Betty Whitaker's husband to get in and out of the house safely.
Well, my husband is disabled. He's in his 80s. I'm in my 70s. He has an artificial limb. He's blind. And he recently had a stroke that affected his right side. So it makes it hard for him to get in and out of the house. It would have been difficult for us to afford this because we're purchasing a new prosthetic. He needs one. My husband needs one very badly.
Fortunately for the Whitakers, Westminster Home Connection is able to provide services free of charge for those who qualify.
He had such a hard time getting up and down the steps, so I think it's going to benefit him tremendously. I think eventually I may need the ramp too, to get up and down, because I have arthritic knees, and who knows.
What we do is much more than home repair. The aspect of the freedom that they can still be independent in ways to be able to move and live in their own home, feel safer. There's a piece there in a sense of lack of worry that would have been there before.
With millions of older adults struggling to make ends meet, There's a need for more income-based services like those of Westminster Home Connection. For now, though, the ability to provide affordable home repairs and mobility modifications remains limited.
There's certainly a capacity of what we can do as one nonprofit in Nashville, Tennessee and the surrounding Middle Tennessee. But what I dream of is that others will come alongside and be interested in what we do and the model that we've developed and be interested in the best practices that we have and come and join us.
I do appreciate you.
There's been lots of research over the last 20 plus years identifying what those risk factors are for falls and what the causes are. And for most older adults, it's really not just one cause. They often have multiple risk factors that increases their risk for falling. So things like the environment, the presence of certain chronic conditions can increase their risk for falling. So diabetes, chronic pain, arthritis, heart disease put them at risk. And those are pretty common conditions among older adults. Medications also are a major risk factor for falls. There is a whole list of medications that has been developed that are shown to be potentially inappropriate for use in older adults. All physicians who treat older adults should be aware of this list. It's called the Beers criteria of inappropriate medications. Benadryl is on that list.
According to the Centers for Disease Control, older adults should look out for medicines that can affect everything from vision to balance and sleepiness. Some drugs that increase the risk for falls include medicines for pain, depression, anxiety, sleep, blood pressure, muscle relaxation, and mood. For Dr. Tara Long, that means taking practical steps to ensure her patient's safety.
It's important for my patients that are older to have a list of medications, write them all down, list of things that they're taking, and then that way when we see one another, we go line by line addressing each medicine, and they might not know the risk, but then I know the risk and then I can address it. Then you take that with the Tylenol and you may actually feel a little bit better than either one alone. Okay. We also have to think about the elephant in the room. Patients can sometimes be self-medicating. They can be taking over-the-counter medicines and not really being upfront. That can be alcohol. That can be other prescription medicines that they're getting from other doctors. That can be over-the-counter drowsy medicines for sleep and for other diagnoses. And we have to remember those substances, alcohol, other drugs, can also cause dizziness, can also lead to further increase in the risk and fall.
Unfortunately, while doctors do play a critical role in helping patients manage their health, fall prevention gets overlooked far too often.
Less than half of older adults who have had a fall have the topic of falls brought up during a doctor's appointment. But doctors are a good influence on older adults, and they should be bringing up falls by asking some simple questions. You know, has the older adult fallen in the last 30 days? Do they feel unsteady on their feet? And do they fear falling? So just a yes to one of those three questions should take action. You know, we should do a screen or an assessment to identify what those risks are for falls.
A lot of times when we're talking about walking, our pelvic bone...
Well, when I fell, I landed on the knee, and it swelled up. It had fluid on it, and it took me a minute to get over that. When I get up, it hurt constantly. Then I started having trouble just naturally walking in it. And then I said, maybe I need to see about this.
According to the Centers for Disease Control, more than 1 in 4 seniors fall each year. What many older adults may not realize, however, is that falling once means you're twice as likely to fall again.
If you have had concerns about falling and you haven't discussed it with your primary care physician, I'm here to tell you, don't be afraid. Ask those questions, bring it up, because risk of falling can be more detrimental than any of or all of the other chronic conditions that you may have. Adjustments can be made, medicines can be stopped, medicines can be reduced in dose size, because as we get older, you may not need that medicine that you've taken for 20 years. It may be that we need to take it away from your regimen or change it altogether.
As a primary care physician, Long is the front line when it comes to assessing her patients' needs and getting them the additional care they require. And through a close affiliation with Nashville General Hospital, she's able to make use of an integrative care system, which is like a one-stop shopping approach to healthcare.
Not too bad. And for the patients that may have trouble with mobility, the integrative healthcare system means that they can have all of their specialist appointments all in one place, one location, and sometimes even on the same day. It's important for older adults to get their vision checked annually because their vision declines as one ages. So it's important that we look at the health of our feet as well, and that's sometimes overlooked because all of these different parts of the body all work together in balance. And when one of those things don't work, then that can and very well may increase that person's risk for falls.
For Deborah Sutton, it's about preserving mobility, independence, and happiness.
I don't want to fall and hurt myself when I might could have something to help me balance myself, to keep from falling and hurting myself. For one thing, I want to be able to walk. I want to walk and play with my grandkids, just be able to move around with them. That's what I want. I want to be able to be with my grandkids.
We've learned a lot about preventing falls and what you can do to maintain a safe and active lifestyle. But sometimes standing on your own 2 feet requires additional tools and support. A conversation with your doctor is a good place to start. You can learn more about preventing falls and see all of NPT's Aging Matters series at our website, wnpt.org/agingmatters.
Major funding for Aging Matters is provided by the West End Home Foundation, enriching the lives of older adults through grant-making, advocacy, and community collaboration. The Jeanette Travis Foundation, dedicated to improving the health and well-being of the Middle Tennessee community. The HCA Healthcare Foundation, on behalf of TriStar Health. Cigna, together all the way. Additional funding provided by Jackson National Life Insurance Company, the Community Foundation of Middle Tennessee, and by members of NPT. Thank you.